Hello, my name is Matthew Drake. I'm a professor of medicine at the Mayo Clinic in Rochester, Minnesota. And today I would like to talk to you about what you, as a patient or caregiver, should know about the FOP care team. There are multiple important core aspects of a multidisciplinary FOP care team. We all recognize that FOP affects bone. But FOP truly has body-wide implication and affects all aspects of your health care across all stages of life. This means that multiple healthcare providers from various specialties and professions will likely be involved in caring for you during the course of your lifetime. The center of this care team includes the patient, his or her family and caregivers, the FOP specialist, as well as the patient's primary care provider. In addition to these core team members, other team members may include doctors from orthopedics, dermatology, endocrinology, rheumatology, dentistry, pulmonary, cardiology, pain specialists, pharmacists, nutritionists, audiologists, rehabilitation specialists, wound care specialists, counselors, or social workers. And finally, it is important to have a radiologist who follows the patient's care over time, and if surgery is ever needed, having an anesthesiologist who is knowledgeable about FOP is also very important. There are important roles that patients and caregivers should undertake. These include locating and identifying healthcare professionals who are knowledgeable about FOP, but also importantly, supporting and educating healthcare professionals who do not have much or any knowledge about FOP, so that these providers can learn how to provide best care for patients with FOP. There are specific steps which patients and caregivers can take. In a perfect world, all providers would share or have access to a patient's full medical record. However, in the real world, patients and caregivers must be proactive to ensure that there is coordinated care between their healthcare professionals. Your primary care physician should have a record of who is your primary doctor managing your FOP, in addition to which other healthcare providers are providing treatment. Your primary care physician should also have their contact information in order to coordinate efficient and effective care. Likewise, all specialty healthcare providers should know who the primary care physician is and have his or her contact information. It is also recommended that you keep and update, as needed, a list of doctors and other healthcare professionals whom you see, and share this information with your other care providers as needed. It is also important to inform your healthcare providers of your individual needs, as these may be different for you compared to some other patients with FOP. Thus, as one example, some patients with FOP have difficulty swallowing pills due to jaw involvement, whereas others are less affected. Likewise, due to specific skeletal limitations, some patients are more easily able to have imaging done, such as a CT or an MRI, whereas others may have more difficulties with specific placement in these machines. It is also important that patients and caregivers for patients with FOP be ready in case of an emergency. For this, we recommend keeping a copy of the emergency guidelines for first responders, physicians, and dentists as available on the IFOPA website somewhere in your home, and have a copy readily available if needed. This may even be posted in your home for others to see. It is also reasonable to keep a copy of this document in your wallet or purse, as well as in your vehicle. You can download a copy of the emergency guidelines from the additional resources section of this website. So what can patients and caregivers do to promote coordination of care? Important steps include making a list of care providers that you see, sharing these lists between providers, and ensuring that medical records are available between providers or are sent when needed if the electronic medical records used by these different care teams do not communicate with one another. I think that we all recognize that FOP is extremely rare, and many, and likely most providers, care for no other patients with FOP. Therefore, it is important to be your own best advocate, both to educate and ensure coordination of care between the many different care teams with which you will likely interact. Recognize that many medical record systems do not automatically communicate, and therefore it is important to make sure that your providers know who the other members of your care team are so they can easily get in touch if needed. I thank you for joining me today and I hope that you found this information useful.